All right, Dr. Duke Majan here, getting ready to stream our second surgery for the day. It is January 19, 2023. This patient presents to us from North Carolina. He has back pain. He has pain going down both legs. Tuesday, just 2 days ago, we did his right side L2-3-3-4-4-5-5-1. He had 4 herniated discs on the right side, pinching the nerves, causing right leg symptoms. Now we're going to be fixing his left side. He has 3 herniated discs on the left side, 2, 3, 3, 4, 4, 5, and we're going to fix those 3 discs on the left side. This comes because he has tears in the back of the disc on both sides, left and right. And I talked to him earlier today. His back pain is 100% gone from the first surgery done Tuesday, which is 2 days ago. His right leg pain is 100% gone. So he's very happy with the results from his first surgery. Why are we doing 2 surgeries? He has too many discs for me to fix in 1 surgery. So we had to split it up. All right, we're going to get started. And again, we've got 3 discs to fix today. I've already given him some numbing medicine. We're going to try to do all of this through 1 incision. He is snoozing, which we like. Shot. All right. That looks pretty good. I think I should be able to get all 3 with this particular trajectory. So we'll start by going to the bottom disc, which is usually the hardest. Num. We're going to give a little bit of numbing medicine as we're doing this, so it helps control any discomfort he might have and makes our anesthesiologist get to use less anesthesia. Less anesthesia is always better. Everyone thinks anesthesia is something totally safe, but it's not. Unfortunately, there are complications that do happen from anesthesia. Though here at Duke Spine, we have a very good track record. Shot. So I'm feeling the facets there, but I am aiming for the correct disc. I may start a little bit more lateral. Shot. Shot. Yes. Feeling good. Yeah. Shot. So you can see I'm going past his facet joints there. I'm just going to redirect a little bit. Shot. Yep, right there, shot. So Duke Spine Institute, we specialize in eliminating back pain and neck pain through minimally invasive surgeries and treatments like the Duke laser disc repair we're doing right now. Shot. And I was just talking to my research fellow who happens to be doing a study now on the causes of back pain and neck pain. And we're going to be looking at all the patients that have come to Duke Spine Institute over the last 10 years. And we're going to basically take each cause of back pain and score each cause based on frequency. Okay? You could see the arthritis at the tip of the needle. Show them the arthritis at the tip of the needle there on the AP view. Henry, stay on the AP view. Show them the arthritis there. That's bone growth from arthritis there. And that's not normal. That shouldn't be there. So arthritis is a common problem, obviously. And it happens in the spine quite often. Shot. All right. One access point done. That's the L4-5, the bottom disc. We're going to make our 7mm incision. That's the only incision we should need to make in this patient because I think we can fix all 3 discs with 1 incision. Thank you, Luis. That's what we're going to try to do. And as I say, God willing, it will happen. We were able to do 4 discs on the other side with 1 incision. So let's see if we can do 3 discs on this side with 1 incision. All right. Aiming again for the L3-4 at this time. You guys can see the L3-4 disc shot. Feeling the arthritis as I'm going past it. I have to navigate past it. There it is. Very nice. And now we are at the L3-4. Okay. So we're at the L3-4 disc. I want you all to pay attention here on that picture. Don't change the picture. Go back to the lateral view. And I'm going to show you something here that some of you have picked up on, I'm sure. Look at the slippage going on here between the L4 bone and the L5. Yes, Jordan is showing you L4, L5 there. The back of the L4, the back corner, and then the front, sorry, the back top corner of L5. Nope, that's not it. Go back further. Yep, there. That should line up with that. But they're not lined up, and we call that a slippage. So all these patients that have a slippage are being told you need a fusion. You don't need a fusion, folks. That's old thinking. Sure, there's lots of doctors that will tell you need a fusion still, and that's why we're telling you otherwise. You don't need a fusion. It's not necessary, okay? Sure, it can be done, but why do something you don't need? Something, especially a fusion. You don't want to have a fusion if you don't need it, okay? And this patient definitely did not want a fusion. Shot? And I don't blame him. He's an active man, and nobody should have a fusion that doesn't need it. AP? Unfortunately, there's millions of fusions being done on the spine every year in the United States that are not necessary. Okay? I used to be a complete fusion advocate. I would do fusions all the time. That looked great. But in the last 15 years now that I've been doing endoscopic surgery, I've come to realize that everything that used to get fused doesn't need to be fused anymore because we can fix it endoscopically without fusion. Fusion is dangerous and expensive. All right, we need him awake. Fusion is dangerous, expensive, and damaging. Damaging to your body. All right? You awake? If I was doing a fusion on him today, instead of the laser, I think I showed you the last surgery on Tuesday, this is the incision. This is the incision. Look how big this is, 12 inches. Because he has 4 discs that need to be fused. So we have to open his back up that big. We'd have to peel all the muscles off the spine, hold them out. We'd have to remove all the bones and ligaments. I've done it 1,000 times. But I don't do it anymore because it's completely unnecessary. We can fix all these problems endoscopically at Duke Spine. All right, he has 3 discs. We're not going to really do a discogram at this point because the other side is healing. I mean, we're not going to do an evocative discogram. And we're not here to fix back pain today because the back pain's already gone. What we're here to fix is the herniation. And the herniation comes out to the left side at each of these 3 discs, and it's hitting the nerves going down, okay? There's actually 3 or 4 nerves that are getting hit on. And they go down the leg and they cause sciatica. So I'm going to do just a low volume injection. All right, low volume injection.
Okay?
Shot.
All right, a little test here. We're going to ask you a pain score.
Well, I don't want his pain score because I want to let the healing continue from his prior surgery. So I'm not going to give him a high volume shot. That's about it right there. Perfect. Okay, done with that one. Does he have any pain? Are you having any pain?
No.
Wow. So we just did the same discogram Tuesday, and he had pain because the disc hadn't been fixed. Now we're doing a discogram. The discs are fixed. There's no pain. All right, we're done. You can put him to sleep. So I just injected dye, and we don't do stage surgeries very often, but you could see the discs are no longer painful. Tuesday they were horribly painful for him. Okay, we're going to start by fixing the L4-5, again, we're not treating the slippage. And I had found that you don't need to treat the slippage. If you know how to do endoscopic surgery, you don't need to treat the slippage.
Yeah.
Where's my dilator?
It's right here.
Oh, thanks.
Yeah. But you need to remove that.
Yeah, go ahead.
Okay.
You're doing 4-5 first, right?
Yes, sir.
Mhm.
Is there?
Yeah, go ahead. You can see the guide wire there at the front of the disc, whereas the needle is thicker.
You want
IV pulse perfect, thank you. All right, folks, any questions for me so far? We're
Yeah.
getting, go ahead.
Yes, we have a question that I believe they are from Croatia, and they are from Facebook, and they asked, do you believe in toxic annular tear, pain cam in toxic annular tear?
Whoa, I'm not sure I understood the question. Thank you, first of all, from joining us from Croatia. If you could repeat the question. I heard something about a toxic annular tear.
Do you believe in toxic annular tear?
I'm not sure what toxic means to you, but toxic is related to what's called toxin. And a toxin is something, my wrist, is something that is a chemical that has a very bad effect on the human being, like poison, for example. I'm not sure what toxic annular tear, I've not heard that terminology used before. But if you're asking me, do I believe the annular tear can cause pain? Of course we do. We're the ones who discovered that. The annular tear is the cause of the pain at Duke Spine. And we're the ones who fix it, specifically with this surgery. This surgery was developed just to fix a painful annular tear. So I don't know if you're saying the same thing, but maybe we are. So yes, I believe annular tears cause pain. Yeah, he's still uncomfortable. Can't really give him any more local. Great question, if that's what you're asking. I think I understand your question is the annular tear, do you believe it can be painful? I don't think it's toxic. When I think of toxic, I think of poisons, like tetrodotoxin or botulinum toxin, or shigella toxin, or staphylococcus toxin. So I think of toxins as being something different, but maybe you're asking the same thing. You're doing great, just lay still. Take it. All right, perfect. So we are now in the left side. We're going to go in and repair the herniations. Once again, he didn't have any pain on his discogram when I did inject. That's because we got rid of the pain last time. Shot. Now we just have to get rid of the herniation that's causing stenosis on this left side. Shot. Perfect. All right, great question. Let's keep the questions coming. I'm happy to answer them. In the meantime, ride along with us as we perform spine surgery endoscopically. We're going to bring you inside the disc through the endoscope. The endoscope is a system of rods and lenses that project the image at the end. We use light to illuminate the end of the scope and see what's in there. Most people are familiar with endoscopes. They're using them in medicine now, quite often in orthopedics, but they also use them to investigate other things, like, for example, if your sewage system is blocked, okay, they'll stick a scope down there and find the blockage. So endoscopes are wonderful tools. They can find leaks in plumbing, find blockages in pipes. They're basically a system where you have a camera that can see an image from a tiny lens And of course you need a light source. And of course we use irrigation because it's surgery. We need to irrigate the fluids out and the material. All right. Why don't we show our video on how does the Duke laser disc repair actually work in the lower back to fix back pain and leg pain.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Okay, so far everything's going well. Once again, we're on the left side in a patient who's already had the right side fixed. So we sometimes will do both sides at a disc, but that's only if the total number of places we're treating is 5 or less. If somebody has more than 5, we have to break it up into multiple surgeries, and that's what we've done with this particular patient. So he had his right side disc fixed Tuesday, 2 days ago, and now he's back for his second surgery, which again is a stage surgery where we break it up into 2 separate surgeries. That's for the safety of the patient, and everything's going well. He's doing fantastic. This is the tear on the left side at L4-5.
We have a question.
All right, we'll take the question.
This first one comes from Matt on Facebook,
Hello, Matt.
and they ask, what issues can the arthritis cause in the back? Does the arthritis in the patient's back cause pain?
Yeah, Matt, great question. So the arthritis that I'm talking about earlier was the arthritis in the facet joints. The facet joint is a second type of joint in the spine. There's 2 joints in the spine. There's the disc and there's the facet. And the facets, there's a left and a right. So for every disc there's 2 facet joints, one left, one right. For example, we're working on the L4-5 disc. There is a left L4-5 facet and a right L4-5 facet. In my estimation, and I don't have the data on this yet because that's what Arias is working on. That's his project he's currently working on, my research associate, research fellow, is what is the actual incidence or frequency of pain from a facet joint. And in my experience, even though almost every human being has arthritis in their facet joint, very few people have pain from that arthritis, okay? And arthritis just means inflammation of a joint, right? Arth is joint, itis is inflammation, joint inflammation. So even though there's millions and millions of people with arthritic joints, very few have pain. And those joints I was talking about that we saw that have arthritis in this patient, they may or may not be painful. I don't think they are. However, about 25% of our patients that have disc pain also have facet joint pain. And we have to treat the facets later on after surgery because if we don't, they're going to have just continue having back pain from the facets. I don't know. I hope that answers your question.
We have another question.
Sure.
This comes from Mohammed on YouTube.
Hello, Mohammed. Thanks for joining us.
And they asked, do you guys accept most medical insurances like United Medicaid?
Yeah, great question. We do accept all insurances, but you have to be careful with what accept means. We'll take your insurance, but they may not pay for your surgery. So what you really need to ask is, will my insurance pay for the surgery? And the answer is, the honest answer is, we don't know. The reason we don't know is that we don't have a contract with the insurances at this time. And the reason we don't have a contract is the insurances don't want you to get better. They don't want contracts with doctors that do surgery. They want as few contracts as possible. So we've tried to get contracts with most insurances, but they don't want patients to have access to the surgeries. So they refuse the contract, hoping that people won't come and get these surgeries done. So to answer your question, I can tell you Medicaid will not pay for the surgery. So United Healthcare Medicaid will not pay for this surgery. Okay? Scope off. Medicaid is state-funded insurance for people who really don't make enough money to afford better insurance. That's really what Medicaid is. And Medicaid is great, you know, for people who have no other way to pay for their health care because they don't make enough money, you know, in their job or whatever they do. And Medicaid is, unfortunately, does not pay doctors properly. As a matter of fact, the only doctors Medicaid pays somewhat decently, they pay 80% of Medicare rates to pediatricians, OB-GYN, and that's about it. So spine surgeons and other types of surgeons, they don't pay us. They pay 20% of Medicare. Medicare pays 10% of our bill. So they're paying 20% of 10%. So they're paying basically 2% of our bill. We can't survive on getting paid 2% of our bill as doctors. We cannot survive. We can't pay our overhead. So we cannot accept Medicaid. That's why people like you that have spine problems, you have a trouble finding a surgeon that will take Medicaid because Medicaid screws the doctors and hospitals in payment. They have a fantasy, dream, the government does. They charge doctors and hospitals obscene amounts of money to maintain our licenses and certifications, and then they expect us to take 2% of our charge to take care of patients that they're paying for. They're absolute filth and scum. And it wouldn't be bad if they told you guys the truth. What Medicaid should say is, hey, sign up for Medicaid and pay for Medicaid or get Medicaid insurance. By the way, 90% of the doctors won't take this insurance because we pay them so little. But still, sign up with us anyway. Now, if they said that to you, then they would be honest with you. So since they're not going to be honest with you, I will be honest with you. I will tell you the truth. Most doctors don't like talking about money. But I have no problem talking about money because money is important to run a business. You can't run a surgery center without money. Nobody's going to work for free, and I have to pay all these people. So I have to pay for electricity, I have to pay supplies. Let me give you an example of the ridiculousness of our healthcare system. There's a television we have in this operating room that I use to look at the x-rays and the endoscope. It's literally, how big is that TV? 60 or 72 inches? 72? 72 inches. When we built the surgery center 10 years ago, I went to Best Buy and I bought 72-inch television for the operating room so I could see on that big screen what we're doing. So I could see, right? Well, when we came back and put the television, the ACA, the Agency for Healthcare Administration, said, you're not allowed to put this TV. Now, I paid $500 for the TV, $500. Pretty good deal, 72-inch, $500. And we said, well, why can't we use this television? They said, because it's not medical grade, medical certified. I said, okay, fine. Let's find the medical one. We found the medical one. $10,000 for a television. And guess what? It was identical to the TV we bought.
Same brand too.
Same brand, same television. I said, what's the difference? $10,000 versus $500. Oh, they said this one's certified. What does that mean? Oh, it just has a stamp. Thanks. So that's your government forcing us to spend $10,000 for a 72-inch television. I have, how many of them here? 2?
Sure.
So I spent 20 grand on 2 televisions, 72-inch, that I could have bought at Best Buy or BJ's for $500, which I did buy. That is the problem. Our government has ridiculous regulations that are lining somebody's pocket. So whose pocket? Look at the name there on the television. It says Steris, S-T-E-R-I-S. That is a company that makes medical equipment. So the medical equipment company, like Steris, goes to Washington and says, hey, corrupt politician, senator, we want you to make laws that restrict hospitals and surgery centers from putting high value products like a 72-inch TV costing $500. We want you to make a law that says they can't do it. Why? Because then they have to buy it from us, and we're going to make $10,000. In exchange, we'll make sure your son gets a special deal, and we'll give him a job working with the Chinese, making $1 million being a consultant. Sound familiar? That's how this corruption affects everyday people like you with Medicaid. It makes it impossible for us to give you care because the care is so expensive for us to pay for, and therefore we have to pass the costs on to you. Anyway, that's where we are in America with health care. Nobody wants to talk about it, but that's the God's honest truth. I don't mind talking about it because I'm not ashamed of it. If it was something I did wrong, I would be ashamed of it. If I was the government, I'd be ashamed of it. If I was Medicaid, I would be ashamed of it. If I was the agent who sold you Medicaid, I would be ashamed of it. But I'm not ashamed because I haven't done anything wrong. But you people need to know the truth. Anyway, long-winded answer, but that's the honest truth with our system. We don't take Medicaid because it doesn't pay.
We have another question.
Now, just one more comment on the Medicaid patient. When people really start caring about you, somebody will approach Elon Musk or Bill Gates and say, Bill Gates, there's a doctor in Florida who can cure back and neck pain. Why don't you take $100 million and put it in a foundation and help pay for people like me who don't have good insurance to get the surgery I need? That's what you should do. You have a greater chance of getting philanthropy to pay for your surgery than you do your insurance. All right. What is the question?
This comes from Ryan on YouTube, and they asked what insurance. I believe that they're asking of what other types of insurances that the surgery takes.
Yeah. Thanks, Brian. Great question. So, Brian, the reason insurances are accepted is more or less because there's a contract. And when you have a contract, the insurance is forced to pay based on the contract, okay? So at Duke Spine Institute, we don't have a contract at the surgery center with the insurance to pay for the surgery. Therefore, we don't know who's going to pay. And I will say this, even if we did have a contract, they still don't pay. They find ways to not pay. They pretend they lose the paperwork, they pretend they lose the bill, and they hope that you don't call them and say, hey, where's my payment? So we've learned over the years that insurance companies are extremely sneaky, even if you have a contract. Even if they're supposed to pay, they don't pay. As a matter of fact, we had a billing person working for us a few years ago. She used to work at Blue Cross Blue Shield. She said that she was doing claims processing, which means paying claims to doctors. She said that every day they had a giant room that all the claims processors sit at a desk, and their job was to look at the claims by the doctors for services, like surgery. And the supervisor would come in and give them a stack of claims. Now, most people could process 50 claims in a day, maybe 100. They would give a stack of 300 claims each. And the supervisor would say, do what you can to pay these bills for the doctors. And the ones that you don't get to, just file them in the garbage. Sweep them off your desk into the garbage. And she said, yeah, but, I mean, isn't that a problem? And they said, nope, that's how we do it here. Okay? So at the end of the day, they would throw away half of the claims in the garbage. Then the doctors would call and say, what's going on with our payment? And you know what Blue Cross would say? We don't have any record of the claim. So this is the kind of things insurance companies do. They do it on a regular basis. They'll never tell you that, but that's how they do it. So the patients think they got great insurance, yet they're not, the doctors aren't being paid. Well, we can't run a business without being paid. So let me answer your question. We've had Blue Cross pay for this surgery. We've had United Healthcare pay. We've had Cigna. We've had pretty much TRICARE. We've had most insurances have paid for the surgery. However, we never know when they won't pay or they will pay until after the surgery is done. So basically, we have to do the surgery first, send the bill, and wait a few months and hope that they pay it. And that, we can't survive off of that, okay? Not when the surgeries cost us so much money. So that's why we have to ask patients up front for some money for the surgeries, and then we bill most of the surgery to their insurance. Now, there are some insurances that we don't even bother billing because we know they won't pay, like Medicaid or even Medicare. Currently, we don't expect Medicare at all to pay, and we tell people who have Medicare, you got to pay out of pocket. Now, that said, we give them a nice discount for the surgery. I don't know if that answers your question. I hope it does. But that's where we are today. Now, that said, Duke Spine is doing everything it can to try to get the insurance companies to pay. We have a team of billing specialists that we send the claims out to, and they fight the insurance companies. We even have lawyers that specialize in fighting the insurance companies working with us to try to get the insurance companies to pay. And I promise you, someday they will pay. That's my goal. But people think all I do is do surgery, but I don't. I run a very busy medical practice, and I run a surgery center, and we're fighting the insurance companies to get them to pay. Each of those is a full-time job, by the way. And we're doing research, trying to publish more results. So we do a lot to try to help patients get the care they need, but we're not magicians, and we're up against the most powerful evil entity in the world, the health insurance companies. Maybe they're neck to neck with the auto insurance companies. Okay. Huh? They're very wealthy, far wealthier than I am. It's not even David versus Goliath. It's literally the fungus on David's toe versus Goliath. And that's what we are. We're the fungus on David's toe, you know, fighting Goliath. The good news is Goliath doesn't expect us to come, but we're coming. Maybe you could think of us as the blob. Each little thing by itself is nothing, but all together with the patients and the law and the good attorneys and the billing specialists and experts that we have on our side, we together become something that hopefully the insurance companies cannot escape and will have to deal with. I think Aetna just lost a lawsuit or just settled a lawsuit for not paying for artificial discs. Artificial discs have been in this country for over 20 years, 21 years now. And Aetna is still calling them experimental. So they're not experimental by any means, but that's how they get out of paying for them, by calling them experimental. There's some granulation tissue. Hey, Arius, Henry has some really good granulation tissue pictures on the thoracic disc we did earlier. By the way, that patient's already going home. He was doing fantastic. He had no pain, and he was ready to go home, the first surgery we did today. But Arias, Henry has a thoracic granulation tissue annular tear pictures. I've asked him to give to you for our paper that we're writing on the thoracic DLDR. I'd like to use at least one of those images in our manuscript. All right, great questions so far. Yep,
We have a couple more questions.
happy to answer them.
This next one comes from, I love the name. The name is Even Rookies Can Wrench on YouTube.
Nice, even rookies can wrench.
And they asked, following on your talking about the insurance companies, he's like, how can we fix this problem so everyone is paid?
Oh, it's a great question. Number one, raise awareness, because there's not one person that can win against the insurance companies. It's the people need to win. It's a grassroots effort. That's the way I see it. Here's what specifically we have to do. Insurance companies are regulated on a state-by-state basis. That means that the states, for example, Florida, has an insurance commissioner. The insurance commissioner runs basically the commission that oversees the insurance companies and makes sure they behave and pay their bills. Well, of course, as you can imagine, the insurance commissioner is a position that can be corrupted, right? And as long as the insurance companies control the insurance commissioner, even though the insurance commissioner is supposed to be working for the people, the insurance companies have tremendous influence on who the insurance commissioner is going to be. They affect the results of who is appointed or elected to that position. So it needs to be a grassroots effort targeted at the laws and lawmakers, aka the politicians, at the state level. And federal would be nice, but that's a big ask. And you know, I'm a Republican, but the truth is that the Republican politicians are the most corrupt. And I'm not proud of that. That's not why I'm a Republican. I'm a bit of a liberal and a Republican, a little bit of both, Democrat and Republican, but I'm not trying to criticize them for any reason except that they just happen to be very corrupt. So what's happening is the politicians are writing laws that let the insurance companies deny treatment. And they shouldn't be denying treatment, but the laws protect them. And the way they deny treatment is by saying that the treatment is experimental or investigational. And once they've labeled it like that, then they cannot pay, they can say they don't have to pay the bill. The problem is nobody challenges them, and it's very expensive to challenge them. And the only way to challenge them is to do, first of all, the appeal, where you have to write letters, 2 of them. You get a first level and second level appeal, and they're just going to blow you off. And then pass the appeal becomes a litigation where you sue them. Now, obviously, lawsuits are expensive, and hiring the lawyers to do these lawsuits is phenomenally expensive. I'll give you an example. I have hired a lawyer to help us, okay? Most lawyers charge around $350 an hour. $350 an hour, most lawyers. The very best lawyers in the country will charge $600 an hour, right? $700 an hour. Anybody know what I'm talking about? Okay? And I have lots of lawyers I have working for me. And I pay them $350, $400, $500, $600. The most expensive is $700. But the lawyers that are helping us fight the insurance company, they charge $1,500 an hour. So think about that. Who's paying that bill? Actually, I am. I'm doing it for my patients because my patients can't afford it, number one. And if you go by yourself against your insurance company, you're going to be paying $100,000 to fight your insurance company to pay your bill. Well, if your bill is $100,000 and you're paying $100,000 to the lawyer, in the end, you're not getting anything. And the insurance companies know that. So what has to happen is it has to be done together in a class action lawsuit, where we're getting a lot of patients suing the insurance company together. So the insurance companies have written the laws to make it very difficult for us to make changes to force them to start paying. But that's how it has to happen. The alternative besides litigation is getting the laws changed by politicians. The problem is politicians are so corrupt, they rely on the lobby money from the lobbyists, and those lobbyists are paid by the insurance companies. So the lobbyists are being paid by the insurance companies, and they tell the politicians what laws to write. That's how corrupt our government is, folks.
Our viewership is tanked.
Huh? Our what? Our viewership is what?
Tanked.
Tanked? Do you think I care?
Yes.
I don't give a shit who watches our video. It could be one person, it could be nobody. That doesn't matter. What matters is the message. Matters is that I'm telling people the truth. Whether or not they want to hear it or whether or not Facebook wants them to hear it, that's not my choice. That's their choice. I don't believe the viewership tanked. Henry, is he full of it or what?
A little bit, yes, he is.
Yeah. Yeah, Arius, my son, what you're going to learn in life is that you don't live your life to make other people happy. All right? Especially when those other people you're trying to make happy are bad people. You live your life to do what's right, what you know is right in your heart. And sharing the truth is right. So anyway, getting back to what I was saying, we're almost done with this disc, another minute or two. The political way to fix this is to have a committee that oversees insurance company denials for medical care. And that committee, maybe it has 10 people, and they would hear cases where the doctor says the patient needs this treatment and the insurance company says it's not appropriate or not medically necessary. So the committee could actually listen to both sides and make a decision, as long as the committee is not corrupted by the insurance company. The problem is any committee, any person that's involved in the laws that control the purse strings of the insurance company, they go out of their way to corrupt and control. So even if it's a public official, they will go and spend money controlling the public officials, including senators, including congressmen, including lobbyists. They use the lobbyists to do that. I'm going to tell you a number that will surprise you. Everyone knows the tobacco industry, right? They sell tobacco products legally in the United States. And those tobacco products kill people. Well, the tobacco industry spends $50 million a year lobbying to have laws that let them sell tobacco that causes emphysema, COPD, lung disease, lung cancer, other kinds of cancer, metastatic cancer, killing people, okay? $50 million in lobbying a year lets you kill Americans with cigarettes and tobacco products. The insurance industry spends $500 million a year. That's 10 times as much. What do you think they get for $500 million a year in lobbying? They get to kill a lot more people. Okay, how do they do that? They deny medical care, deny cancer treatment to cancer patients. I remember when I was a resident in neurosurgery, I was shocked to hear one of the neurosurgeon's wives had leukemia, and she needed a bone marrow transplant. And the head of the insurance program was the chairman of neurosurgery at UC San Diego, okay? And the chairman of neurosurgery was the head of the insurance program, and he denied the resident's wife from having life-saving treatment for her cancer. He said, nope, the chances of success are 10%, and it's not worth spending $100,000 to save somebody's life when there's 10% chance. That was the most eye-opening experience in my career, that one human being could make a decision to allow another person to die because they didn't want to spend $100,000 for a 10% chance of survival. Okay? I just feel it's wrong. I don't mean we should just do crazy things for people, you know. We shouldn't spend $1 million for a pill that may or may not work. But when you have a treatment that's known to work like this surgery, the insurance company should not be allowed to deny it to people. And I can't fix that by myself. I need you guys to fix it. I can only guide you and help you and coordinate, but I can't do the actual heavy work myself. Great questions. But since our viewership has tanked, I'm sure there's no more questions because nobody's watching, and that's okay.
No, we have a lot of questions.
Yeah. Listen, just to clear the air, I'm Dr. Arjik Majan, CEO and founder of Duke Spine. And here's the thing. The things that I talk about, I know for fact. And I'm not concerned about sharing my opinion because my opinions are based on facts. Okay? They're opinions based on sound proof and fact from my experience doing this for 26 years. And you may not agree with me, and that's fine. I'm not trying to get everybody to agree with me. I'm just sharing my opinion. Take it or leave it. It doesn't matter to me. I sleep well at night whether you believe me or don't. If I'm talking to 10 people and none of them believe me, it's fine. I don't have a problem. I'm not here to be an influencer. I'm here to be an educator, okay? Yep. You want some more num num? It's going to cost you.
Amen.
All right. We're going to give a little more num num. This is our last disc, and again, this will be the 7th disc fix we're doing on this particular patient in his back. And I can share this with you. He's a minister, and he's a very well-known minister. His family is in ministry. They found the Duke Spine online. They actually have their own online ministry. And he watched enough of our surgeries and enough of our patients' testimonials. He became a believer. And here he is. And I told you, after his first surgery on Tuesday, 100% of his back pain was gone. His right leg pain was gone because we already treated the right side. He's very happy with the results, but he wants his left side fixed. We were planning on doing it as a separate surgery, and that's what we're doing. So you see where the tip is on that x-ray? I could feel the herniation already. So I'm pushing the herniation back in right now. I don't like the guide wire. It's so far in the front of the disc. I'm going to pull it back a little just to be safe. I don't want it going in the front of the spine and poking something. It shouldn't be. So what kind of things are in front of the spine that we have to worry about? And by the way, show them the front of the spine, Jordan, just so we all know what we're talking about. That arrow is showing you the front of the spine. Okay? There's the intestines, your colon, small intestines, bowels basically. You've got your ureter for your kidneys. The bladder is further down. You've got blood vessels, arteries, veins, big ones. So we don't want sharp things going out there poking around. You can cause damage. And we've never had that happen, but of course it can happen if we're not careful. All right, we'll take the rest of the questions.
Okay, this next, well, first up, we have a comment. This comes from Canes25, and they said, I think you need to run for president, sir. You speak more sense than any of these clowns representing us.
I truly appreciate your sentiment and comment. Believe me, if I could fix the United States and make it better, I would run for president. But I unfortunately don't believe one person can do that. Even if their goals are true and they're for the people, I just don't believe, because there's so many corrupt politicians in Washington, D.C., and every president I've ever seen. And to be honest with you, I know a lot of Republicans don't like Obama. I actually liked Obama because I felt like he tried to do what was right for the people, even though there were some mistakes made perhaps. But he had good intentions, and I see just how much resistance he had to making changes that he believed, and I believe probably, and many of them were actually good for the American people, helpful against corporations. And you saw the resistance, and a lot of the things he wanted to do didn't get done. So my fear is run for president, have all these great ideas to fix things, but then none of it gets done because there's so much opposition from the evil that has infiltrated our government. That's my concern. The other thing is, I noticed when Obama went into presidency, he actually looked really good. He was, handsome and healthy, but then after a few years, he looked like he aged 10 years in two. So it makes me think that being a president is a really stressful, tiring job for these people. And it's not that I don't want the challenge of it. It's just that I feel like I'm doing more good right now with what I'm doing here, helping people get rid of their back pain. So I appreciate the comment. Trust me, I would do it if it meant that I could fix problems in this country, but I just have tremendous skepticism that that's possible. Now, in case you didn't know, I actually was involved in politics back in high school and college at UC San Diego. I was a senator. And I'm going to share just quickly an experience I had my first year as a senator. It was a freshman senator for Third College, now called Thurgood Marshall College at UC San Diego. I was elected. I campaigned the first few weeks of school in 1987. Long story short, I went to the student government meetings, which is like politics, and every college had, there's 5 colleges at the time. They all had a freshman, sophomore, and senior senator. So 5 times 4 is 20, plus the president and vice president and secretary, treasurer, and all these other people. There were about 50 people in the meetings. And the items on the agenda that we discussed were typical items related to students and improving the quality of life for students. And I was amazed that the things that came up for voting, the items that came up were so obvious. Some of them were so obviously good for the students. There was no downside at all. And it was an easy vote to say yes. Yet there were people lobbying to say no. And I couldn't understand why. And then I found out that they were lobbying to say no because what they were really doing was they were saying to the other senators, hey, you can buy my vote. I'm going to say no. But if you want me to say yes, come talk to me and convince me. And the way you're going to convince me is by telling me, I'll vote yes for you now, as long as you vote yes for me in the future when I have something I want to do. So we would literally spend 2 hours talking about whether or not toilets, like portable toilets, should be made available to students and families at the Sun God Festival, right? The Sun God Festival was a once-a-year festival. 10,000 people would come, and there weren't enough bathroom facilities, and we were voting on whether to spend, $5,000 on putting portable toilets out there for people to use. And it's an obvious yes, but people were arguing about it for 2 hours. And I realized politics just sucks because there's so many people with special interests, agendas, and people aren't really doing what's right for the people that hired them, that elected them. So I hated politics after that. I got out of it, and I just feel like it's so backwards in this country. But it starts at a very early time, in these people's careers, and this, I don't know, bartering or whatever you want to call it. So anyway, thanks for the comment. I wish I could fix the problems, but I've got to try to fix it by motivating you guys to fix it. Next question.
Next question comes from Even Rookies Can Wrench, once more on YouTube.
All right.
And they asked, what got you interested in spinal surgery? And thank you for all that you do.
Oh, great question. So I was just going back, give a little history. My dad was a doctor, and he loved what he did. He was an OB-GYN, and he was just so happy with his work. He just loved it. Of course, it had challenges back in the 80s, Insurance companies were starting to, make trouble for doctors and patients to get care. But for the most part, he felt medicine and patient care was like the greatest thing you could ever do. He was there with women as they had babies, men and women. He felt like this was the best time of their life. They loved, having a baby, and it was just great to be around them during that. It was a happy time. So it kind of rubbed off on me and my sister and my brothers, and we all became doctors. But for me, I was at UCSD. I was interested in anthropology. I was interested in finance. My son is interested in finance. And I was actually wanting to be an investment banker myself when I was like 16, 17. But I don't know, I was drawn to biochemistry and I was drawn to the sciences, you know, the biomedical sciences. I just really enjoyed understanding biochemistry and how all of life is basically based on biochemical reactions happening in a cell and in the environment. And I just love learning about those reactions and how they created life, basically, a living organism, etc. So I became fascinated with science and then medicine, of course, and ended up going to USC for med school. I thought I was going to be an orthopedic surgeon, but then I watched some orthopedic surgeries, and they were doing joint surgery on the hips, shoulders, knees. I got really bored watching it. I thought, this is really boring, you know? And then I didn't know what I was going to do. And then at the end of the first year, I took neurosciences for the first time, and we studied neurophysiology and neuroanatomy, all the neurons and tracks, and I realized, oh my God, this is the coolest thing in the whole world. So I knew I liked neurosciences. I knew I wanted to be a surgeon. So my choices were psychiatry, neurology, neurosurgery, and the only one that does surgery really is neurosurgery. So that's where I kind of got interested in medical school at USC in Los Angeles. Turns out the chairman, Dr. Weiss, was a pretty well-known neurosurgeon, and he guided me after that. Told me to do research, I did. Told me to apply to these different programs, I did. And it just grew from there. So I ended up in neurosurgery training at one of the top, at the time, the top neurosurgery training program in the country, University of Florida. And I was going to be a pediatric brain surgeon. So I was going to do what Ben Carson did, you know, take out brain tumors in kids. And I started to do my pediatric neurosurgery rotations, and I realized, my God, this is the most depressing thing in medicine, taking care of babies that are dying from brain tumors. And the people that did it professionally, like my pediatric neurosurgeon, Dr. Mickle, you know, he was really good at it. And he was just a different kind of person than me. To be honest with you, it requires a lot of patience on the part of the surgeon, just sitting there answering questions. I'm not a patient person at all. That God didn't give me that quality. I mean, I am patient in some ways. Obviously, I went through neurosurgery training for 7 years. But I'm not that kind of patient where I can sit and talk to people. I like actually action. So I started to shy away from pediatric neurosurgery and got really interested in epilepsy surgery and functional neurosurgery, which is, you know, treating the brain and the disorders of the brain that cause functional illnesses like epilepsy or movement disorders. And then I got an NIH grant to do research on epilepsy. I did that for 2 years. It was really cool. But the spine surgeon showed up at our program. His name was Jeff Henn, and that changed everything. I ended up operating with him like every day for 2 years, doing all these really neat, late state-of-the-art spine surgeries. By the way, they were fusions and artificial discs. And so I got really good at them and realized that I could help a lot of people with those surgeries get out of pain. So I ended up choosing spine surgery, and I was doing all these fusions and artificial discs and things for years, and then I came across this endoscopic stuff. At first I laughed about it and said, this is a joke, you know, laser spine surgery, sure, whatever, right? And then my wife said, you need to go check it out. So I checked it out, and I was really, to be honest with you, once I saw it done, I was shocked. I was shocked and awed. And I said, how is this possible? And, you know, I'd never seen anything like it before because it's not taught in our training. It was something, it's kind of off to the side, you know, something new, something different. Anyway, I started doing these procedures because the patients were doing really well. And I realized the patients that have this surgery, I was able to cure their pain just as well as I do with the fusion, except they don't have to go through a fusion. So obviously this has grown in popularity in my practice. More and more people want it. and I provide it. And now I'm at a point where I almost don't do any more fusions or artificial discs. It's all minimally invasive surgery. So that's my story. And I have no regrets about anything I've done. You know, I was talking to my son about it the other day, and he said, yeah, but you have to go through a whole 7 years of neurosurgery training. And I said, yeah, but it's still worth it because you learn so much that, you know, makes who you are in that training. Neurosurgery training is unbelievable. It's the toughest. It's kind of like being a Navy SEAL, you know, but in medicine, a Navy SEAL of medicine, if there is such a thing, by going through the rigorous training of a neurosurgeon, especially at a top program. So I'm very happy. I wouldn't change any of it. And my brother's a neurosurgeon, but he doesn't do endoscopic surgery. He's kind of, I think, a bad choice, but that said, that's his choice. So we have 2 neurosurgeons in the family, and my son, hopefully, and my daughter, hopefully someday. But I wouldn't change it for anything. We're done. Yeah, we're done.
Lights on, please. Thank you.
So that's the last disc. It looks fantastic. We're done. All right, so I'll answer another question or two while we wrap this up, but then I'll answer questions face to face.
Scope up. Thank you.
Henry, you there?
Yes. We have a couple comments and a couple questions. Comments from Ryan Digg or Dilg on YouTube. They said, thank you for the insurance info. Great work today. The next comment comes from Lorraine on Facebook saying, I love what you're saying. It's the truth. Thank you. And
You're welcome.
2 more comments, or 3, excuse me. These 2 are coming from Keynes25, saying the doctor is correct. There's power in numbers, and there's never been another time in history when the people need a voice, especially those that suffer. We are here, and we love listening to you, doctor.
Thank you so much.
And the next one comes from Lori, saying, I am watching. I was listening. I love your honesty. Keynes25 commented once more, saying,
Thank you, Lori.
you give people hope when they lost all hope, sir, whether you know it or not. And
I appreciate that, and that's really what it's about, is hope. And, you know, maybe we can't fix everybody that needs it today because of insurance issues, but believe me, I'm working on that, and that's going to be my commitment to all of you, all the people in the world suffering. I'm not just going to give you my life and my dedication, my time. Obviously, the money we collect from people, it goes towards these, basically towards this, what we call the initiative, which is to take the insurance companies to the mat and really to defeat them in court so that they're forced to pay for these surgeries, because that's how it's going to have to be, I think. And that's what I can do with the help of my patients. What you guys can do is, like I said, try to bring about change at a political level by basically holding politicians accountable to making laws that allow doctors and patients to make decisions about their health care rather than an insurance company deciding. And the insurance companies always tell you, hey, we're not deciding, you know, what surgery you should do. We're just saying we're not paying for it. Well, by not paying for it, you are deciding, right? Because people can't afford to pay the kind of money that's needed for spine surgery on their own for the most part. So anyway, I appreciate those comments.
we have a couple of questions.
All right, let's do this. I'm getting out of the room. Let's do the questions face to face. I'll be there shortly, and I'll answer all your questions for you. So feel free to type up a few more. Also remember, Duke Spine does have an app online. It's free. It's called the Duke Spine Institute app. You can find it in your app store. And we created it. It's a really cool app. I think it's got a lot of good information. But I'll come answer your questions face to face. This is Dr. Ara Duke-Machen, CEO and founder of the Duke Spine Institute. I'm here with one of my patients, and you've traveled from where to the Duke Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Duke laser disc repair done and the Duke plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
The really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well.
Yes.
And so what are you going to do now that you've had the surgery? And you could see actually the Duke laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. It's constant, it's always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
The biggest thing I want to do? I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith and being
thank
brave
you.
and getting it done.
Oh, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Duke's Spine Institute, Dr. Duke personally, to help you fix your back.
Thank you. Appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. All right. So now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
I'm Dr. Ara Duke-Machen with the Duke Spine Institute, and I'm here with one of my patients who just had the Duke laser disc repair on her lower back, and she wants to share her story with you. Now, you came to Duke Spine Institute because you were having back and left leg pain for how long?
Well, the terrible left leg pain, probably about 2 years, but prior, I mean, I've had issues since I was 14 years old. So it's been a lot of roller coaster pain since then.
So you've had back pain since you were 14. You're clearly not 14 anymore.
No.
And so that's like 15, 20 years, right?
Yeah, too long.
And so why didn't you get it fixed sooner?
Well, the doctors when I was younger didn't want to operate. They wanted to, I was young. They didn't want to take a chance because all the surgeries then at that point, there was just nothing there that wasn't going to be traumatic to my back and my spine. So I went through physical therapy, shots, decompression. They did that and nothing was really working. And then it eventually kind of got better, and then it would get worse and it would get better, and it was just up and down, up and down.
Up and down. And the reason it got better was the inflammation from the injury to your disc started to get better.
Yeah.
But then you'd have another herniation with activity, and then it made it worse. So
Yeah.
when we were in there, and you can see from this video right here that we were pulling out lots of big fragments of disc herniation. You probably over your lifetime from 14 until now had at least 10, 20 different episodes of herniation, and that's what we saw when we were inside there.
Mm-hmm.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
Now, you're not from Florida.
No, I'm from Ohio.
So you traveled from Ohio to the Duke Spine Institute in Florida. Why did you come all the way down to Florida?
There was nobody near us or anywhere near us that had any other option besides either getting a discectomy or a laminectomy or a fusion. There was just nobody was doing anything else. And I knew I didn't want to do that again because I'd already had that done. So it didn't work. And
Didn't work.
I had a really amazing physical therapist that connected me with you, and the rest is history.
Yeah, your physical therapist found us and was intrigued with the surgeries we're doing here
Yeah.
and sent you here. So what are you going to tell your physical therapist? I call him Dr. Salinas. What are you going to tell him when you...
Oh man, I mean, I've already told him. I texted him the minute I got back to our Airbnb. I said, I feel amazing, and I can't wait to tell all the rest of the patients in our Facebook group, like, this works. So
It does. The Duke Laser Disc Repair really does work. Well, is there anything else you want to say to your fans out there or friends?
my fans and my friends, thank you for praying. Thank you for believing me. I think that's one of the biggest things. There's a stigma around back pain because you can't see it, that people are just faking it, or maybe they're babies. Like, why can't you just deal with the pain? And it overwhelms you. And so to come someplace that believes me and then fixes the problem, and now I'm sitting here and I can be like a fully active mom. So I'm just beyond thankful. Thank you.
Yeah, chronic pain robs people of their dignity and their happiness and joy in life, and also their loved ones, the people that care about them,
Yeah.
because they suffer with you.
Yeah.
Yeah.
A lot.
Well, congratulations and praise God.
Yes.
You found us,
Thank you very much.
and I think you're going to do fantastic.
I'm looking forward to being strong again.
Awesome. All right. All right, welcome back. It's been a long surgery and a good surgery. This patient, as I've said before, already had the Duke Laser Disc Repair done on the right side at 4 discs. We did that 2 days ago. His back pain was completely gone after the surgery. His right leg pain gone, but he still had left leg problems because we hadn't done the left side. Well, we just did the left side, and it went perfect for him. Anyway, over here in Florida, it is definitely the lunch hour, so I'm going to answer the questions for you while I eat my lunch, which you can all see we don't get any money from Wendy's, but I do like their chicken breast sandwiches.
It's not chicken breast.
It is.
It is. It's not.
What is it, armadillo?
It's actually ox penis.
Ah,
It's armadillo sandwich from Wendy's.
armadillo actually.
All right.
doesn't make it. Try it once. Coming back, so we have a question from the Pooh Girl 1970 on YouTube. Like Winnie the Pooh, you know.
Pooh Girl. I
Yeah.
love it.
And they said, I've been referred to Baylor in Houston to Dr. Roper. I'm 52 and have had a cervical 3-level fusion and a 3-level lumbar. I have a herniation in thoracic area now that hasn't been helped by injections. How long does it take for you to review and schedule consult or surgery? I live in Southwest Louisiana, almost to Texas, so I'd have to prepare for a stay or not if I had surgery.
Yeah, sure, Pooh Girl. So thank you for commenting. Your thoracic disc herniation is one that we can fix very easily. You saw it done today. It depends on which level you have. I don't know what thoracic level, but maybe you can type that in.
The MRI report says central posterior disc protrusion is noted at T11 through T12 level, and annular tear is noted within protruding material.
Perfect. So T11, 12, it's exactly what we did the first case this morning. Oh, by the way, the first surgery we did, if you watched that, that we did a T11, 12, T1201. He said his thoracic pain and lower back pain are 100% gone. He's up walking around. He's actually leaving right now. He was just so thankful for us fixing his back. And we'll be able to see him tomorrow and hopefully get him to do a testimonial. Arias, you have any questions for me? All right, nothing. My son wants me to do a dance. So
no.
I'm going to try to do my dance for you guys before I answer any more questions. So let's see. What is that called? The gritty. Gritty. All right. Gritty. I'm sorry if my gritty offended anybody, but getting back to Pooh Girl's question, we can definitely do the endoscopic procedure on you. And as far as getting an MRI review done, that's the first step. And we have a free MRI review and a virtual consultation. So you can actually spend 10 minutes with me where we don't charge you anything. There's no gimmicks, no advertising. It's literally just you and I for 10 minutes talking about your thoracic MRI and how we fix it, answering any questions you have. Our surgery, you see, if we did a T11, 12, will take about 30 minutes, and it's done with a tiny little cut on your back. And then it's a 1-hour recovery and you go home. You need to be here for about 3 days. If you came in on a Sunday, we would spend time in the clinic on Monday doing all the history and physical and submit for insurance authorization, all that stuff on Monday, surgery Tuesday, and fly home Wednesday. I think we had a patient from Louisiana just last week, right?
Yeah, literally, yeah.
Yeah. Excuse me, he was a 5-level lumbar, and he's doing fantastic. So hopefully that answers your questions. Next question.
Next question comes from John Leatherberry on YouTube.
Is that Leatherberry or Weatherberry?
Leather, the fabric, Leatherberry.
All right.
And they said, lost it for a second there, apologies. And they said, I am having ACDF surgery on C5 through 6, C6 through 7 to correct diagnose marked foraminal stenosis. Have tried conservative treatments. Everything I have read is that that this is a highly successful or high success rate surgery. Agree?
Yeah, so one of our viewers is saying, hey doc, tell me about the ACDF surgery. And it's supposed to be very successful. Here's what I would say, okay? First of all, from what you're telling me, the Duke laser disc repair would be the perfect surgery for you to have, which is the endoscopic surgery. Why? We do it through a cut on your neck that's 4 millimeters. If you have time, check out our YouTube channel and look up cervical Duke laser disc repair on the playlist. So go to the Duke Spine YouTube channel, go to playlists, scroll down on the first section, and you look for cervical Duke laser disc repair. That's what I would do for you. That's the most successful, least dangerous surgery with no complications. We've not had a single complication. This is a fusion, ACDF, okay? The surgeon, whoever's doing your ACDF, and I've done 1,000 of these surgeries, by the way, the surgeon's gonna have to cut your neck. That's gonna create scar tissue and horrible pain. Then they have to make their way down to your spine, and right in front of the spine, you have blood vessels and you have your swallowing tube. They're gonna pull on your swallowing tube, and you're not gonna be able to swallow for a while. Now, some people have permanent problems from that, and they need a feeding tube. Hopefully you won't be one of them. The other thing is there's a nerve right here in front of the spine that goes to your voice box called the recurrent laryngeal nerve. Sometimes the doctors trash that nerve and your vocal cord can't move anymore, so you can't make sound on one side. The other side will probably still be fine. But that's another complication of ACDF. Vocal cord paralysis. Look it up. Serious complication, by the way. Anyway, then they're going to clean your disc out and put in these little cages right here. You guys see that? The little gray cage behind the plate? Yeah. There's 2 of them. Then they're going to bolt the plate on. Why would you ever want metal on your neck? The Duke laser disc repair is safer, faster recovery, better results, and there's no metal or cages or any complications because it's so minimally invasive. To answer your question, if I did your ACDF, it would be very safe, very successful. The problem is that not all spine surgeons are equal. And there's the best, and then there's everything below. And when you get to the middle of the pack, you start getting really bad complications from surgery. You don't hear about that. When you go to the doctor's office, do you think the doctor's going to say, oh yeah, I had 5 complications last year with ACDF? They're not going to tell you that. Okay? So, here's the facts. If you look up in the literature, and there was a paper just published, ACDF versus PCDF, the complication rate for ACDF, 48% of the patients had a complication. Basically 50%. So that's a coin toss that you're going to have a complication from that surgery. I wouldn't think that's a good thing, especially with Duke laser disc repair, 0% complication rate. So 48 versus 0. And by the way, those are complications. That has nothing to do with the fact you've got a metal plate in your neck and you can't move your spine now. That's just a consequence, not a complication. I wouldn't want that. So I would rethink your ACDF seriously, because there's a lot better treatment out there available now. Sorry, don't mean to scare you, but I am going to give you the truth. Next question.
Next question, it comes from Doug, once more on YouTube. They asked what, it was from during the endoscopic, what is all the white fluffy stuff? Is that inflammation?
What is all the white fluffy stuff? Well, I don't have that in front of me right now, but the fluffy stuff is usually going to be the annular tear and the herniation.
Next question.
Hold on. Now, if it's yellow, that would be the fat. So I believe if it's the white stuff, it's going to be mostly the annular tear. And scar tissue can also be white.
Okay, next question comes from Matt on Facebook, and they ask, does it take longer for the back to heal after this surgery versus fusion?
Oh, wow. Oh, no. Matt, the laser surgery you just watched, this patient's back will be healed in literally 1 day. With fusion, you're talking about a year, 2 years for the back to heal. Sometimes it never heals. What takes a long time to heal with the laser surgery is when I clean the tear with the laser, that tear needs to heal over. That's not something I do as a surgeon. It's something the patient has to do over the next 12 months. So the disc itself will heal. Now that I've cleaned it, it's ready to go. It's going to start healing tomorrow. But it will literally take 1 year to fully heal. The disc. The back itself, the skin, the muscle, the fascia, all that stuff's healed by tomorrow.
Okay. And then following up with the Pooh Girl 1970, they added on to saying it's a multi-level desciation and disc height loss, mostly in the mid-thoracic spine and thoracic spine. Posterior disc protrusion, eccentric to the right approach, paracentral foraminal zone at T7-8.
T7-8, okay.
The level causes significant spinal stenosis, disc protrusion noted throughout the thoracic spine. My pain is mainly at the bra strap level and goes through the chest.
Yeah, that's T7-8.
Yeah.
So, Pooh Girl, thanks for clarifying on your thoracic. We weren't sure because what we saw was the T11-12 herniation, but if it's your bra strap area, it's T7-8, and that would be that right herniation at T7-8. The Duke laser disc repair is literally the most perfect surgery for you. It's all done in literally 30 minutes. We've not had any complications. We haven't done that many. We've done under 20 total in 3 years that we've been doing it. But I feel we could do T7-8 easily, safely for you, and give you great results. We go on the right side, obviously.
All right. Last but not least, another question from Doug once more on YouTube, asking.
Doug's on fire.
Yeah, man. And he's asked, how soon after surgery are you able to hit the gym?
So how soon after surgery are you able to hit the gym is the question. Great question, Doug. The answer is usually within a few weeks. However, when you go to the gym, I don't want you lifting heavy weights. There is no heavy weightlifting for 12 months after the surgery. What is heavy weightlifting? Well, basically 40 pounds lifting is your maximum for the first year. All right? This is very important, Doug. If you do the right thing for your spine and you let it heal for a year, at the end of the year, you can do whatever you want. There's no restrictions. Your disc is healed. You're not going to have a problem again. Now, if you start heavy lifting too soon, you're going to push out another piece of herniation. Okay? Think about a toothpaste bottle that's got the cap off. Now it's open. If you squeeze it, the toothpaste is coming out. So in the first year, just think about your disc that I've just fixed as being a toothpaste bottle without a cap. If you lift too much weight, you're putting pressure on the disc, you're squeezing the jelly. It's got a place that can come out. By the end of the year, that cap is back on and you can't re-injure it.
And that is it.
All right, I hope you enjoyed the live stream and video. I'm going to finish my lunch, my Wendy's, and we'll see you in another hour. We've got a 2-level Duke laser disc repair in about 30 minutes. And this gentleman is from New Jersey?
I think so. That one.
New Jersey. And he's had back pain going into his left leg now for some time. And he has 2 herniated discs, L4-5, L5S1. And we'll have that live stream in about 30 minutes if you're interested.